Hey, everybody. Welcome to the exciting world of acute low back pain and what to do about it. Presented to you by Doc Hockey. And yes, that's us. All right. We've now taken the opportunity to get our signage on mini stick rinks, okay, in people's houses. I know. I was lucky enough that one of my favorite clients decided to put us up there. And let me tell you, I'm seeing now, slashing injuries from bruising as well as knee pain like bursitis. So, you know what? These injuries are going through the roof at my office now. So I recommend you go and helping out the youth in their own homes. It's a really untapped resource of advertisement. All right, guys, take care with that and let's move on. All right, I'm Pro Action Health and Performance. I'm Dr. Shane Bayless. We're at 308 Palladium Drive, Suite 108, 613-505-5000, and it's proactionsportsclinic@gmail.com if you want to contact us. And hopefully we'll hear from some of you after this presentation because you're interested in what we have to talk about and our expertise. Symptoms of that acute low back, often severe pain with immobility. So a lot of people have a hard time moving around after it because of the severe pain that they have, so they really don't move a lot. Secondly, antalgic lean. So the question mark position, they're usually stuck in a certain position, forward, backwards, or even that kind of S kind of curve. We're like, why are you standing like that, right? And people often don't know why. Coughing, sneezing might hurt. So when you're coughing or having bowel movements, you're pressing downwards, increasing pressure into the spine. Mornings are worse. So when they wake up first thing in the morning, it's a lot worse. And as the day goes on, actually gets a little bit better. So it's usually helpful along those lines. Rolling over in bed. So just turning side to side. They really don't like to do that because it's painful as well. Sitting is the worst. Better to lie down or even standing up is often things that we hear about. And what do all these things have kind of in common or are relating to as a diagnosis? Disc injury, right? As you can see right here, we have like a little herniation, or it could be a bulge that goes in there. It's hitting that nerve in the background, or it's just hitting some of the nerves in the disc that creates severe low back pain. So let's go back over the stuff that we just talked about. Often severe pain with immobility. So you injure the disc, it inflames, it's hard to move because anytime you move the spine, it's extremely painful because it's getting that painful spot to be loaded. And obviously that's going to create more pain. The antalgic lean, usually if there's swelling on one side, there's an injury in the disc, we leaned off to offload that. So when people say, oh, I was offloading, so my wife told me to, or my husband told me to keep leaning back the other way to make me more straight, that's not the right thing to do. Your body's doing this for a reason, right? To help heal up that injured spot or that ligament that's been damaged, so you're not having the pain or that load put on it. Coughing or sneezing, why is that painful? Because when you cough or sneeze, you increase the pressure inside the spine, which compresses that injured spot. And everybody knows we don't like to compress anything that's already injured, just like we don't like pushing on bruises because that hurts because of the sensitivity in that area. Mornings are worst. As we lay down and we sleep for so many hours, our discs start to hydrate. We're actually taller in the morning than we are, later on in the day because of gravity putting pressure on it. So the mornings are worse just because it's putting a lot more pressure on that nerve or that injury that's in the disc and creating more pain. Rolling over in bed. It's that twisting action of rolling over in bed, and you're not using your muscles to guard against it because you're not using the muscles. You're using the passive elements, which are ligaments and discs, which are basically already inflamed. So rolling over in bed is often a bad thing. It starts to go away as you start to heal. Why is sitting worse? Well, when we're sitting down, we put a lot of pressure onto that disc. Now, our ligaments in our back part of our spine, which hold in the discs and some of the vertebrae, they kind of taper down as we go to the bottom part of our spine, which leaves little gaps in the sides of the disc where you saw the nerve in that picture. And that puts an opportunity for that disc to be pressure on the nerves, as well as they become less stable because there's nothing holding it inwards. In the neck, it's a little bit different. It has a full ligament across the back, so it doesn't taper down. So there's a lot of less neck injuries and disc injuries in the neck. Not that they don't happen, though. So that's why sitting is worse because it puts pressure on that disc and you're leaning forward. So it pushes all those elements of the back of the disc into where the injured spot is and just makes things a lot worse. That's why laying down or standing can be easier. There's our disc. There's our injury. There's that nerve behind it that can put pressure on it, or it can be inside the disc. We have ligaments that have been damaged. Home treatment. So people are like, what can I do if I'm, On a weekend where no one's available to get treatment, or maybe I'm away on a vacation or traveling, one of those things, we want to give them ice, right? We want ice 10 to 15 minutes. Then we take a break until the body heats up again, and then we put it back on. And we do that for repetitively throughout the day, especially in those first couple days of injury and acute pain. If it continues to be acute pain and that's severe, I continue to do that, up to a week and things like that to make sure that we're helping decrease the inflammation. Moving, walking, crawling, stationary bike, swimming, walking. We just want to get movement in there. Not a lot. Like, some people are like, I can't even move, can't get off the couch. I don't care if you're crawling on the couch or you're putting, pressure on the couch and then you go to the counter, whatever. Just get some movement, right? Our veins do not have a contraction in them. Like our arteries pump blood. Our veins rely on our muscle movement to get rid of some of the toxins that build up. And we got to get the toxins to get rid of it so it doesn't pool and create more inflammation in that area. Recumbent bike is the best. That's the one where you're laying back and your feet are in front of you, just because it puts less pressure on the back than sitting up and leaning forward. It's just like sitting on a seat where you're leaning forward, puts a lot of pressure on the low back. Swimming is really good. Just be careful about kicking exercise. So the front crawl, if you're doing a lot of kicking, that can increase the hip flexors, which puts compression into the mid abdomen and puts pressure on those discs. Bracing. So back braces are good. Some people have those Osiform braces that you can get off of Amazon. You want something that's a compression that gives that stability in through the area, right? It doesn't have to be a hard plastic brace, but something that puts pressure. We use Bauerfeind braces. They're medical grade. They're really great. You can have different, tensions and stuff like that too. That can be helpful. Taping. I don't really put a kinesio tape, but I put leuko tape or a strong athletic tape. So it's a stabilizing tape, not a movement tape like kinesio tape can be. Kinesio tape can be good because it does offset the mechanoreception. So you feel somebody that's almost like massaging you. But overall, I want a stability tape, not a stretching tape. Drink water and non-inflammatory foods. Water is really good to get more circulation, get rid of the toxins, bring in nutrients. Non-inflammatory foods, we're already inflamed. We don't want to add anything to that. So we're talking about, the vegetables, the omega-3s, magnesium, those types of things to really help out with getting the nutrients in and getting the toxins out. Less sitting, more standing. We've been talking about this all the time. We want to stand more. We want to lay down more. We want to change positions every 15 to 30 minutes. Okay. I understand you can't stand for too long. You can't, sit for too long. Everything we want to do is change it up every 15 to 30 minutes, just so the body has a chance to rejuvenate and the muscles aren't being taxed in that same position all the time. Need to sleep. Okay. If you're not sleeping, I know you're not healing. So if you, contact your pharmacist or your medical doctor if you need something to help you heal and sleep at night to take a little bit of that pain, but you do need to sleep. That's where we do most of our healing is during sleep. If you're not sleeping, I know we have a longer recovery for sure. Treatment. Will you get better? These do get better. When you come see us, though, you're going to get better faster. Okay. So 2 to 8 days when we're getting better. Sometimes the other ones can start lingering a long time. Even though it will get better on its own, it does get better from us because we're going to help do that and prevent further complications. We speed up recovery. We decrease spasms. So it's the spasms is the contraction part that really hurts. We increase mobility. So your range of motion, bending forward, leaning back, will come back a lot faster. So you'll get back to those daily activities that you want to do, exercise and stuff like that to make you stronger and hopefully prevent other things. And we give you the education, what things to do. Don't do sitting, the exercises that we talk about in a second are all important so that you know what to do and you're not afraid. And when people have a plan, they know what to do. They're usually better off and they're in a better mental mindset to help them on their way and to be encouraged. We all know how important it is to be mentally prepared for things and just to be in a good mood and have a good outlook on things. Clinical therapies, right? What do we do at our clinic that is, different than a lot of clinics or even what you're going to be doing at home? Laser, right? Laser decreases inflammation and swelling. We do it a lot of ankle sprains and things like that for hockey, soccer, basketball, volleyball, all those things get big swellings. Increased circulation. So we're getting more circulation because the water goes into the bloodstream and helps out increase the circulation. So more toxins out, more nutrients in. Lymphatic system, immune system, we're all upping their function as well. And how do we do that? We increase the ATP and energy of the cells. So the cells turn over faster and we get rid of the old stuff, bring in the new stuff, help everything go really well. Active release technique or ART, stripping. What is our primary cause at the beginning? Get rid of the spasming. Okay, so we get rid of spasming. so that there's that less immobility and as well as less pain. Okay. We also want to get rid of scar tissue that's putting compression onto the joint, the disc, those ligaments. So the ES, which is erector spinae muscles, those are your filet mignons, the big thick ones, very tasty because they're full of muscle. We want to make sure we get rid of those and strip those muscles down. Hip flexors, they go from your hip here, your abdomen, your spine, and then goes into your hips. So doing this is your hip flexion. We want to make sure that those are functioning well. It's a 2-point muscle, so 2-joint muscle. So it basically goes from your hip and your low back. So when you have to do 2 things, it often gets overused a lot. Our quads, that will bring your hips forward. So if your hips come forward, there's more pressure on the back where the injury usually is. And our glutes, sometimes they just spasm to help out with the back. So we want to make sure the spasm is going down. Taping, like we talked about, we do an X tape, okay, across the back from the SI joint, which is basically where the bump is, and it goes up to the mid part of the back, or kind of like where the curve kind of changes, to make sure that it has that stability. So if you're bending forward or leaning back, or whatever, you have some stability in the area. The muscles don't have to work as hard, helps relieve spasm. All right. And then we have our exercise protocol. So let's go right to that right now. All right. Exercise, right? Look at that. Cats do exercise in the morning. They're always stretching. So here we go. We want some semi-weight bearing exercises, right? The cat's doing, it's kind of laying on its back. We don't want to do things upright or standing up or with weight, right? We want to decrease the weight so the disc isn't being more loaded than it already needs to be. Pelvic tilts, cat and cow, probably know a lot of that. Knees to chest, hanging and traction. Okay. So hanging and traction, we often can do that. Some people have, the CrossFit gyms have the rings to doing, but hey, chin up bar, you can hang from that. I have seen people do it on, door frames. You can actually get those chin up bars that go onto the door frame, right? They just hang there and you can just hang with that. It shouldn't be very painful for that. And you don't have to do it that long, 30 seconds or even less than that. You're just kind of hanging, getting some traction so the spine is elongating. You're not feeling as much pain. All right. That helps rejuvenate those discs and give it a little break so it can have more circulation and nutrients. Here's our exercises. All right. Pelvic tilt or pelvic tilter. Here we go. I have a little video of that. So let's take a look.
Here we do a pelvic tilt. This is really good for low back pain. We should be laying on our back. Our knees are up, laying flat. You got a pillow under your head if it's more comfortable for you. So if you want to bring it up just a bit, that's fine. And then you're going to be flattening the back against the table. So you might start out with the arch of the back. If it's, inflamed, you might be more comfortable there. You're going to flatten the back downwards. You're rotating the hips this way, flattening so the back is nice and flat against the table. And you're imagining your head going this way and your butt going that way. So you're getting that traction into the spine. We're holding it there for about 2 seconds. And then we're going to relax. Breathe out. Hold for 2 seconds as you're flattening it there. And then you just relax. Do that.
All right, our cat cow yoga style. So let's take a look at this video here.
We're doing cat cow exercise, the yoga moves. So we're doing that just to help with the back, just to get some mobility in this area. So we're going to be here, hands are underneath our shoulders, our knees are underneath our hips, and we're just going to be moving in a sequential order. So from our low back, we're going to dip that downwards, come upwards, up like this. That's our cow. Then we bring it down, bring the head downwards, up to the mid back, then on the mid back, lower back, and then you're going all the way up. You don't need to push. You can do it nice and easy. This is just to get some movement in there. And I want you moving the body more of a wave than it is in a unit. So I don't want this and this. I want it in a unit going upwards, nice and easy. Tuck it in, tuck it out. And it's a nice even flow. We don't need to hold it in any certain direction. Just need to go with that. And basically what we're going to do is just getting it nice. If there's any pain with that, just do lesser amount of movement, just so that you're getting some movement in through the spine.
Knees to chesty or knees to chest, right? Let's take a look at this.
Okay, we're going to do the knees to chest. This helps stretch out the low back in a semi-weight bearing position. You're just going to have your hands underneath your knees. You're bringing it all the way towards your stomach. Nice and hold there. You should get a good stretch in through the low back. And just going forward, you're just going to breathe out. Chiral action go each side if that helps massage the back a bit. Something easy to do. It's a good stretch rather than putting too much pressure in a weight bearing position or doing a child's pose, which sometimes aggravates a low back condition.
Good. Okay, so those are some of the key acute low back pain exercise that we try to do so that we can get some movement into the spine. That's the big deal. All right. Preventative exercise. So further on, when things are less acute and you can move a little bit more, we have our side planks, we have our bird dogs, we have our curl ups, right? Those curl ups underneath your eye. No, no, no. I'm just kidding. It's like a little sit up where basically you're just bringing the shoulder blades off of the table or the bench or the floor, whatever you're kind of doing on it. And then we have cars, which is controlled articular rotations. Really important for us to maintain a range of motion and strength stability throughout every single range of motions. Because a lot of these things, like a side plank and a bird dogs, are mostly linear. We want to make sure that we're strengthening the sides of our low backs as well. And the cars is a great exercise to do that. If you want more information on that, please contact us. That's a whole nother seminar to begin with. All right. So, life preventative tips for low back pain. So, if you've had low back pain before, you want to prevent it from ever happening because most people do get it. We want to what? Limit sitting, right? Sit to stand desks are a great thing to employ, especially if your employer is willing to do that for you. It's worth the hassle to do that so you can sit and stand and change positions all the time. They always saying that sitting is the new smoking. Running is great because every time you run, you activate one side of the muscles of the low back, then the other ones, you're strengthening them up by running. If you can't do that because you've had some back pain before and it's just not something that the pounding you can take, we can do things like elliptical, you can do the bicycle, and you can even get a treadmill for the desk if you want. That's something you can add in. I always tell people try to add things in during your day that are something that wouldn't prevent you from doing other things. So I run to school in the morning because the kids, I got to take them to school anyway. Why don't I run them in the morning? That kicks off the exercise for me. It means something I don't have to do later on in the day and make time for that. Because everyone will say, I don't have enough time to do this. Make it something that you can do, right? In those hockey rinks or whatever, sometimes they have those exercise things upstairs where you can still watch it. Or maybe at the soccer field, you can just walk back and forth, listen to a podcast, something that you normally would do. Traction, we've talked about that. Hanging from a door frame, hanging from a chin up bar, all those things are a great thing to do on a regular basis as well, just to help that spine become unloaded. Maintenance appointments. I'm getting right into maintenance. Yes, these things will go away, but they do come back. We're creatures of habit. We do the same things over and over again. We sit at a desk, we play hockey, we go running, we do just different things all the time, but they're usually the same type of things. We do the things that we like or the things that we have to do from a job perspective, right? So massage, chiro, physio are all good to do. We usually do about 1 month to 6 weeks. It's a really helpful thing for our patients to come and see us once in a while rather than have to see us a whole bunch of times because they're having an acute injury. Yoga strengthening. Everyone's a little bit different. Doesn't everyone need yoga? Oh, we need some stretching. That's good, but not everyone needs yoga. You might be really flexible. If you're really flexible, I'm not going to say go get a yoga routine going, and step it up. No, we want to get strengthening in there so that the ligaments and the passive elements are not being taxed all the time because the muscles aren't strong enough. And if you're not very flexible, you're already stiff in the morning, you can't really bend forward, touch your toes, and you notice that you're stiff and you don't have that flexibility, you probably want a yoga, right? We want to step up the yoga and doing that, practice the breathing, get that mental aspect out there, as well as get the long stretches that you will never spend that much time stretching, but you will in a yoga class. Those are great things to think about, and hopefully that is helpful. Okay. Thank you very much. This is Pro Action Health and Performance. If anyone has any questions, please ask them now. That'd be great. And remember, you see results with us. That's the big thing. We're all about results. We get a lot of people seeing results every time they kind of come in. We have a progression. We have testing that we use with them to make sure that things are going well and that we're seeing them improve. That's really important. Anyways, thanks for taking the time with us today. Hopefully we can prevent those acute low back pains, and now at least we know what to do. Have a great day.